So are you looking forward to being discharged following cardiac surgery at Liverpool Heart and Chest Hospital? Here's some information to support you and your family throughout the discharge process. We will supply you with 28 days worth of medication on discharge. A copy of your medication will be given to yourself and we'll also post one to your GP. It is important that you make an appointment with your GP within 28 days for a repeat prescription. Your GP and your cardiac rehab nurse can change the doses of your medication prior to you returning for your post-op review. It is important that you do not borrow from or lend any medications to relatives or friends. All medications should be taken as prescribed and no doses should be missed. If you do run out of medication and miss a dose, it is important that you seek advice from your GP and pharmacy, who will be able to supply you with the missed dose whilst awaiting your repeat prescription. It's normal to have some redness, bruising and tenderness around your wound site. If any changes appear to the wound, such as the wound becoming excessively red, gaping open, the surrounding skin becoming hot to touch, a change in odour or excessive oozing, you need to seek advice. You can contact the Recovery Advice Line on 0151 600 1056, 24 hours a day and 7 days a week. Alternatively, you can contact your own GP. It's advised that you keep your wounds clean and dry and only using warm water when showering and washing. We do recommend that you don't bathe for up to 6 weeks. We also recommend that you do not use any perfume, soap, talc or shower gels on your wound until it is fully healed. This is usually around 6 weeks. On discharge, you will be given 1 pair of TED stockings and you will also go home with the pair you are wearing. We recommend that you wear your TED stockings for up to 6 weeks. You can remove them for 30 minutes a day and it's your choice when you remove them. The DVLA state not to drive for 4 weeks, but us at Liverpool Heart and Chest recommend that you don't drive for up to 6 weeks. However, if you have any problems with your wound, we recommend that you do not drive until you've been seen in your post-op review clinic. You do not need to inform the DVLA of your surgery, but you must inform your car insurance. If you are to start driving a bus, lorry or taxi, you need to contact the DVLA to make sure it's safe to drive. You can write to the DVLA or you can call them on the details shown below. Also, the information is available in the discharge pack. For large goods vehicles, you need to ring the number that is shown below, and that is also available in the discharge pack. You may also need to take advice from your employer. It's quite normal to experience some pain and discomfort within the first few weeks. This can be around your wound, around your shoulders and around your rib cage. You need to make sure you're taking regular pain relief as prescribed. If your pain continues or worsens, you need to seek advice from your GP, who can increase your painkillers. We need to avoid any heavy lifting and avoid using your arms to get out of chairs or to get out of bed. We refer you to a local cardiac rehab team on discharge. The programme usually starts around 6 weeks following the date of discharge. A member of the cardiac rehab team will contact you in around 2 weeks to arrange this. Cardiac rehab involves a long-term commitment from yourself and from a team of healthcare providers. The first stage will either take place in pre-op clinic or whilst you're in hospital. A nurse will come to speak to you regarding your diagnosis and procedure, maintaining a healthy weight, healthy eating, alcohol units, the benefits of physical activity, managing stress and anxiety, and how to stop smoking. We will also explain regarding your medication. It's recognised by your consultant as an important part of your recovery, along with taking the prescribed medications. The doctors and nurses at Liverpool Heart and Chest strongly recommend that you attend the cardiac rehab programme. It will help regain your confidence in giving you stepping stones to reduce further risks by adapting to a healthier lifestyle. It has been found that patients that don't attend cardiac rehab are 3 times more likely to be readmitted within the first 6 months. If you haven't been contacted by the cardiac rehab team within 2 weeks of discharge, there is a number available in the discharge information pack that you can contact. If you do have any queries, here at Liverpool Heart and Chest we have a trust cardiac rehab nurse that you can contact. This number is also available in the discharge information pack. There are a number of healthcare professionals available that you can contact on discharge. They are the recovery advice line, you can contact the ward, your GP, the cardiac rehab nurses, the out-of-hours NHS service, and also if you had an advanced practitioner whilst in hospital, you can contact them. If you do need immediate help for things like dizziness, palpitations, or you're experiencing chest pain, it is important that you contact your GP or take yourself straight to a local A&E department. If in any doubt, ring 999. Finally, if you do have any questions regarding your discharge, you can speak to the nurses on the ward. Us here at Liverpool Heart and Chest Hospital wish you well in your ongoing recovery. Thank you.